Good evening, everyone. I hope the audio visual is going well, which means you can see me, you can hear me, and you can see what I'm pointing here on the board. Yes, so please, people watching, just give me a thumbs up to let me know that the audio visual is okay, so that I can just begin and take you through this small but very important part, the orthotics and the braces. So fine enough. So I think things are going well. So I think I can just quickly get started with this small area, the orthotics and the braces. Well, let me tell you, just a half an hour session on the small area, and trust me, you will at least pack up one MCQ into your bag or maybe more. Now actually, these are now the equipments that have now gone into a relatively separate branch from orthopedics, that's PMR, physical medicine and rehabilitation. But then orthopedics overlaps with this branch to a great extent. So in some or the other way, orthopedic surgeon also carries somewhat information on these things, and that's why perhaps I'm here teaching you this very vital in a small area. Now concerning these orthotics and the braces, well, let me tell you, different fields, different people, different teachers would be using different names to eventually speak regarding the same stuff, what's called an orthosis. Now orthosis, I would simply put it as an equipment that is helping a body part. So it aids a body part, cuts down the pain, improves the function. So that's what an orthotic would simply see. Now this orthotic is sometimes called a cast or a slab. Now here the essential thing is that the material used will be POP, plaster of Paris. Okay, and this will be used for helping out people who have had fractures. So when you are using an orthosis for supporting a fracture and it's made of plaster of Paris, that's where we say that this is a cast or this is a slab. Now splint is also something that's used for the same purpose, but it will be some non-POP material. But again, the use will be for the fractures. Like for instance, this particular picture, I'm sure you are very well aware, a very popular, what we call as a Kramer wire splint. So this is basically made up of aluminium. So this is an aluminium frame we generally apply when we wish to splint fractures. Okay, so that's what a Kramer wire splint is. So I'm using the word splint because it's not made of POP, it's made of aluminium, but it's being used for fractures. Now when you talk about rather this term brace, okay, now this will be an equipment that will be used for painful conditions that will be not fractures, other than fractures. Like for instance, we use a tailor's brace, we use lumbosacral corset brace. So here the indication may not strictly be a fracture, but yeah, it could be, because they are actually very overlapping terms, can be used synonymously also, but generally, like we are using a tennis elbow brace. So tennis elbow will be a soft tissue condition, we can call it a brace. Now when we are talking of say a caliper, this will be an equipment where it would be generally supporting joints, spanning joints, to improve their function. So that's where we say that this is a caliper. Okay, so all these different terms eventually come down to the single term orthosis. They are all different orthoses, different terms being used to talk about the same equipment that can be scientifically best called as an orthosis. Now this nomenclature is so complex and so overlapping. So that's why the International Society for this Orthotics, they came out with a very refined definition. They simply say that define any orthosis by using two words. As far as the first word is concerned, it should simply mention the joints spanned by that orthosis. And as far as the second word is concerned, it should simply be this word O. Like for example, if you look over here, what I have shown is that very popular foot drop splint. Now if you see here, the ankle has been spanned, the foot has been spanned, and if you see the knee, that has been spared. So if you look here, it is the ankle and foot that has been spanned. So foot drop splint will be called as an ankle foot. That will be the first word. The second will be orthosis. So AFO, you can put it in a simple way. So that is how you will be noting the foot drop splint with this latest nomenclature. So all these ways are just different methods of speaking about an orthosis, which will simply be some kind of an equipment that will be helping a body part in a painful scenario. Clear with that, guys? So dear first year MBBS student, doesn't matter, I'm going to take you through the basics, and you're preparing for NEET PG perfect enough. Trust me, at least one question you will see if you're clear with this small area. So just half an hour you need with me today. That's it. Now look at the splint that is shown in the figure. You have to tell me the purpose for which you are going to use this splint, this brace, this orthosis, all synonymous. So people who are watching, can I have some inputs on this? This particular splint that is shown in front of you would best be useful for which of the following conditions? Yes dear? So please guys, please put in some choices, some answers in the chat box, and absolutely no negative marking in my class. I always encourage you to answer, because even if you answer it wrong, I would simply say that the mistake here would become a memory eventually, and it will help me clear your doubts in a much better way. Okay, so Tony says it's a patient with ankle sprain. Ash says it's a patient with ankle sprain. No. This is actually used for a patient with poliomyelitis. So perhaps I think I've got it. You've not been able to identify what this orthosis is. This is actually something called a floor reaction orthosis. Very special kind of an orthosis used for paralytic disorders. Like for example, if you talk of the floor reaction orthosis, it will be used in cases of poliomyelitis, cerebral palsy, so paralytic disorders. And what you classically find with some of these paralytic disorders, that person will be having a weak quadriceps, the knee muscle, the thigh muscle, the muscle that straightens the knee, quadriceps femoris. Now this is a splint specially designed to help this out, weak quadriceps. And mind you, quadriceps is the commonest muscle in the lower limb that is involved in polio. Now just understand, if someone has this weak thigh muscle quadriceps, he cannot extend the knee, because this muscle quadriceps simply tends to be the major knee extensor muscle. So when you apply this foot drop splint on floor reaction orthosis on this patient, okay, so this patient has been applied this floor reaction orthosis. So what you find, that when this patient will land, the foot will touch in this position of equinus, because the knee cannot extend completely because the quadriceps is weak. So eventually the body weight will try to bring this ankle down. Now as this ankle will go down, knee will extend, and there is a strap at the back. Look at this strap here. This will prevent extension. So this will push the leg forwards, back the knee into flexion, but then there is a support in the front, this front pad. This will further push the knee back into extension. So eventually these two straps convert this body weight force, the reaction of the floor, into a force that stabilizes the knee into the extension position. So that is the concept on which this floor reaction orthosis is based. So it is basically a kind of an orthosis that is meant to help people with weak quadriceps, stabilizing the knee in the extended position, because by itself quadriceps cannot hold the knee in extension and you cannot stand straight. So you land up with the toes touching the ground, the body weight brings the heels down, the leg tries to go back, the strap pushes it in front, the front strap pushes it back, so stabilizes the knee by two equal forces from front and back, right in the position of extension. So that is how this flow reaction orthosis works. So I hope you're clear with the indications of a flow reaction orthosis, and please do not confuse this flow reaction orthosis with a foot drop splint. I know you are very familiar with foot drop splint. It is used in a common peroneal nerve palsy where you find a foot drop. If you will look at the foot drop splint, you will find there is no thigh pad. But if you see over here, there is a front thigh pad and there is a back calf strap. So when you see a front thigh pad, a back calf strap, that will be a flow reaction orthosis. When you don't see anything going till the knee, there is no thigh or thigh pad or strap, there is simply an orthosis going on the back side of the foot. That's what you call as a foot drop splint. So clear enough, guys? Both of you guys clear enough that what is a foot drop splint and what's a flow reaction orthosis? Fine. So since I've spoken of these nerve palsies, foot drop using a CPN palsy foot drop splint, I think I can just let you know about few more splints we use in nerve palsies. See, in ulnar nerve palsy, the common problem you find is claw hand. And you're very well familiar what is clawing. In clawing, you have hyper extension at your knuckles. So you have to bend the knuckles. So this special splint we use in cases of ulnar nerve palsy, that's called a knuckle bender splint. The problem in median nerve palsy that we tend to find ape thumb. The thumb is adducted like an ape. So we want to put the thumb into abduction and opposition. So the splint that is used in such cases is called an opponens splint. And I don't think I need to tell you even a word about radial nerve palsy. You're very well clear. The diagnostic sign in radial nerve palsy tends to be wrist drop. So we have to keep the wrist extended. So this particular splint that we use is called a cock-up splint. So these are the classical splints, braces or orthoses we use for some common nerve palsies. And yes, maybe you are aware of this particular problem that's called Walkman's Ischemic Contracture. This is basically a sequelae that develops from missing the treatment of this problematic condition called compartment syndrome. Now sometimes you don't treat compartment syndrome, and there occurs ischemia of a compartment in the forearm or in the leg. So that compartment muscles undergo necrosis. That necrosed tissue is replaced by fibrous tissue. The fibrous tissue tightens up to bring the fingers, wrist into flexion contractures. So you want to stretch these contractures. So for that particular reason, we use this special splint that's called a turnbuckle splint. So here you can turn this buckle, and as you rotate this buckle, a contracture stretches up. So I think looking at this buckle, you can very well make out that this is a buckle to stretch a contracture. So this is a splint that has to be used for some condition where you find contractures like Walkman's ischemic contracture. I don't think I need to tell you the purpose for using this particular splint. Spot on. So you have the brachial plexus, going from here, from thorax into the arm. So this is a splint that is being given to relax the brachial plexus in the people. It's called a aeroplane splint. So this is what we give to people with brachial plexus palsies. Brachial plexus palsies. Clear enough, guys? So some important splints for nerve injuries. Okay, fine. Now this particular one, counter force brace, is used in the treatment of Now there was a question in the recent AIMS paper that's gone by just a couple of years back on this counterforce bracing. So I've shared the choices with you. Any idea about a counterforce brace? Yes. Any inputs on this? Anyone who can help me out? Like for what purpose do we use a counterforce brace? Okay, so one choice is that we use it for a partial claw hand. Fine enough. Any more inputs? Or any better input? Yes, and everyone can participate. No negative marking. So any idea for what purpose do we use a counterforce brace? Mallet finger. Okay, so Yashika says mallet finger. No. That's the answer. I think perhaps she got confused because she was thinking of this particular splint here. Actually, this is something called a frog splint, and this is the splint used for mallet finger. In mallet finger, you have rupture of the extensor tendon of finger. So the tip of the finger drops. So you have to keep the finger straight. So for that purpose, use the frog splint. But counterforce brace is used in absolutely a different condition, and that's tennis elbow. Tennis elbow. See, the problem in tennis elbow, you have inflammation at the lateral epicondyle of the humerus, the common extensor origin. So this is basically lateral epicondylitis. Now what we do in counterforce bracing, look at this brace that has been tied. The point of injury is here, lateral epicondyle. But if you look at this brace, it has been tied distal to the lateral epicondyle. So you have all the extensor muscles going like this, and it is the origin of the extensors that is the site of pathology. Okay, so if you see this brace, it has been tied distal to pathology site, not at pathology site. And the reason is very simple. When you tie this brace over here, it compresses these muscles to the bone here. So this particular area becomes the new origin. Because what is an origin? Where a muscle is compressed to bone. So when you tie the brace over here, this becomes the new origin. The original origin is offloaded. So when you tie this brace distal to site of pathology, this basically offloads the injury site. So that is how this counterforce bracing works in cases of tennis elbow. So clear, Yashika? Clear? So I hope now you are absolutely clear what is a mallet finger brace, frog splint, and what is a tennis elbow brace. Okay, and tennis elbow brace is also called a counterforce brace. Perfect enough. A word about these braces we use for scoliosis. I hope you are clear with what is scoliosis. What you find over here is a lateral deviation of spine, like you can see in this X-ray very clearly, like this. And this lateral deviation has to generally cross 10 degrees to call it scoliosis. Of late, there have been number of questions from this particular area. So just taking you through some important braces. So what you are seeing in this first image is a very popular Milwaukee brace. And what you are seeing in the second image is the Boston brace. Charleston brace is rarely used, so let me just brief you on these two braces first. Milwaukee brace is the brace that gives you the best correction. But the problem with this brace is a very heavy profile, bulky brace. Look, there's a neck attachment, there's a pelvic attachment, there's a chest attachment, there's a lateral pad also. So it's a very bulky kind of a brace. The problem with these braces that they have to be worn for more than 20 hours per day, MCQ. Okay. So heavy profile is very difficult to tolerate. Now this Boston brace gives you a reasonable correction, good enough correction in scoliosis, but it tends to carry a much low profile, far easy to wear if you have to wear it for 20 hours a day. So just in case you've been asked, most common used brace in scoliosis, that tends to be the Boston brace. So please have a good look at this Boston brace and look at this Milwaukee Brace. There have been questions on both these braces in the INICET as well as the NEET PG paper. So clear guys with these two braces? Okay. So this is what I was talking of, a Taylor's brace. The FMG exam that has just gone by was carrying a question on Taylor's brace, and this is used for dorso-lumbar spine fractures. And what you see over here is ASHE brace, ASHE. This is also used for same purpose, dorso-lumbar spine fractures, and this word ASHE, it basically stands for anterior spinal hyperextension brace. Hyperextension, ASHE, ASHE brace. So these are all those braces that are used for dorsal spine fractures. Now if you just see over here, these are pictures of some common cervical collars you will be finding in your everyday practice. The first one is a soft cervical collar. The second one is a hard cervical collar. And the last one, that's a Philadelphia collar. Now this is used for neck strains, muscle strains. Fine. Hard cervical collar, again you use for soft tissue injuries in neck. But if you talk of Philadelphia collar, this is used when there is a suspected cervical spine fracture. I'm sure you would have gone through the guidelines of ATLS, Advanced Trauma Life Support, where you try to protect the neck when you're suspecting a fracture and you use the Philadelphia collar. Clear guys? Please have a good look at them. Okay, so these were the important cervical collars. From there, moving on to some important braces we use in cases of congenital dislocation of hip. Now here the goal of treatment is to keep the hip in a position of abduction so that the hip can be contained within the acetabulum. Now for this there are two popular splints we use. The first one I've shown you is something called a Pavlik harness, and the second one I have shown you is something called a von Rosen splint. Particularly popular is the Pavlik harness, practically also and in your MCQs also. So please have a good look at this Pavlik harness. Clear guys? There was a question in the INICET paper a little time back on Pavlik harness and also the Milwaukee Brace of scoliosis. So please have a good look. Now congenital talipes varus. An orthopedic surgeon popularly calls this as CTV. And the problem here is that the foot tends to be deformed. Now in this foot deformity also we use some special braces. One is these special shoes that we use, CTV shoes, that have been shown over here. The other one is this very popular splint that you see over here. Two shoes tied on an iron rod that help in correcting this deformity. So anyone who can help me out with the name here? Anyone who can help me out with the name of this particular splint? This picture was there in the FMG exam that has just gone by. It's been there earlier in one of the NEET PG exams. So please have a quick look and let me know the better name for this particular device. Very popular. Trust me, very popular. Yes. Anyone who can help me out? Okay, no issues. I'll help you out with this extremely popular device. It's called a Dennis Brown splint. So please have a good look at this. It's called a Dennis Brown splint. And one last question before I end up the session. If you have to choose an orthosis in a patient with flat foot, so what do you think would be the best choice regarding the heel? It's a flat foot, so give a flat heel, or it's a flat foot, so give a higher heel, or no, give a crook type of a heel that is elongated medially, or give a crook type of a heel that is elongated laterally. So Tony, Ash, Yashika, anyone who can help me out with this particular question? Yes, anyone? Anyone who can help me out with this particular question? Flat foot patient, what would be the ideal heel you have to prescribe to him so that his flat foot can be tackled? Anyone who can help me out with this one last one? Alright, so I suppose this is an area a little new to you, but trust me, plenty of questions come from this particular area, at least one in your exam. So I'll help you out with this. So this is what is flat foot. So what you basically find in flat foot, this flat medial longitudinal arch in the foot. So the first option you simply have over here is an arch support, and I would aptly say a medial arch support like this. The problem with this medial arch support, that this is generally an insole. It has to be kept inside your shoe, and sometimes you have to wear sandals. You're going on a party and you can't wear a shoe, or sometimes you want to wear shoes without insoles for different reasons. So in this particular scenario, you can also modify the heel to help you out with flat foot. The heel you will use in people with flat foot then would actually be something that's better called a Thomas heel. And what you would find with a Thomas heel, that it will be crooked heel and it will be elongated medially. So that's the right answer there. So it's not the high heel, it's the heel that is crooked and elongated medially that we prescribe in people who tend to have this problem, flat foot. And I'll show you how this works. See, it's a crooked heel, like this S-shaped heel. Now if you see the lateral side, it is shorter, and if you see on this medial side, it is longer. So it is elongated medially. Now please imagine this patient with flat foot. So when he puts his foot on the ground, on the medial side there is a bigger support, on the lateral side there is no support. So I'm putting my foot on the ground, okay, on the medial side there is big support, but on the lateral side there is no support. There is very little support on the lateral side because there is a short heel, so the foot will drop onto the lateral side. Now as this foot will drop onto the lateral side, the medial side will be lifted up, giving you the arch, because that is what you need in a patient with flat foot, an arch on the medial side. So clear guys, why we use this Thomas heel that is crooked and elongated medial in people with flat foot? So I suppose we are clear with some of these important orthoses. Any queries you have from the area that's been covered till now? So quickly, 2-3 minutes to tackle any special queries you have from the area. Okay, so please take this lecture seriously. Trust me, it's a very simple, very easy area, and at least you seal a question if you have at least relevant information on these particular things. Okay, so more things you want to learn from me, please subscribe to this amazing platform, Unacademy. Okay, you can find live classes, batch courses all existing there. You can go with live tests and quizzes also to refine your performance. You wish to maximize your benefit? Even Prep Ladder is now a part of Unacademy. You can go with the iconic subscription where you can have advantages of both of them at a very economical cost. Some heavy discounts are going on now. This 20% one, especially very attractive. You wish to avail this offer, you can use my referral code OrthoLife. But time is limited, so please be a little quick in case you wish to avail this 20% discount. Just sharing with you some batches that are coming up with us on Unacademy. The people who are targeting INICT, 27 July, this revision batch is starting. So quickly subscribe if you want to, reap all the benefits of this particular batch. There's a batch also coming up for the repeaters, the test and discussion batch. All 19 subjects will be taken care of here. So in case you want, okay, you can subscribe for this 6 months batch also. And a very interesting feature, with which we've just come up at Unacademy, the doubt clarification sessions, because people tend to get a lot of doubts as we teach. So there's a session dedicated to doubt clarification every day for all 19 subjects. Okay, so you can avail this benefit. Okay, so you can't get the offline notes here, dear. For offline notes you will get if you subscribe to Unacademy, but yes, if you subscribe for the yearly subscription you will get the offline notes also. Otherwise on Unacademy, if you will search, you will find that after every class you can download the PDF and the notations, the notes the teacher gives you after every class by just a click of the button. So just explore this site Unacademy and you will find all the benefits there, and the subscription price is extremely economical. Okay, so they're so economical, and if you just use my referral code OrthoLive, you further add on that wonderful handsome discount. So economical it is. So thank you for your patient listening. Just reminding you once again for that 20% off that is going on. Very little time left. So subscribe quickly and avail the benefits. So that's my referral code OrthoLive. Thank you for being patient. Thank you for watching. Bye bye. Good night. Okay, you want me to tell the Telegram group? You can connect to me on this group t.me Dr. Mukul Ortho. So in case you wish to connect to me on a Telegram group t.me Dr. Mukul Ortho, so that's the group you can use. Fine. Sure. Bye bye. Good night.